Hi, my name is Dr. John Schnorr. I'm a reproductive endocrinologist and I'm proud to be one of the co-founders of Coastal Fertility Specialist and proud to be the Division Director of Reproductive Endocrinology for the Medical University of South Carolina. I appreciate you spending time with me today so that we can discuss a very important topic, which is preconception genetic screening. Preconception genetic screening is new technology which is available to help us identify if you or your partner are at increased risk for having a child with a birth defect. Testing is now available through blood testing, which would help to look for things such as cystic fibrosis, spinal muscular atrophy, sickle cell, and other common disorders. When you came in as a new patient, I'm sure you had a lot of questions. The questions were, should you even be here for evaluation? What could be causing your infertility? Can you undergo treatment? What would the cost of treatment be? And will treatment work? Well, it's clear that you're interested in moving forward with treatment, and my number one goal is to provide the highest quality of reproductive care possible in a safe and compassionate environment. And so this video is going to teach you about ways we can maximize your chance of having a healthy child. This is not a substitute for an in-person talk and consult, and if you want to talk about this in person, you're welcome to do it. At the end, you're going to get a chance to choose between no testing, or actually seeing a genetic counselor. If you have any questions along the way, please know you can always call us. Our phone number is 843-883-5800. I look forward to seeing you soon.
A frequent question that I'm asked is, what are genetic disorders? Well, genetic disorders are abnormalities of either the chromosomes or the genes of a fetus, which then results in a different disease that the fetus could have due to the abnormalities of the chromosomes. These genetic abnormalities can be inherited from the mother. They can also be inherited from the father. And they can come as a new mutation in which the baby actually gets a normal DNA sequence from the sperm and a normal DNA sequence from the egg, but when they reconstitute each other to create a unique individual, there's abnormalities that are created resulting in a new mutation that the fetus has, which is a genetic abnormality which can result also in a genetic disorder. We know that there are some ethnic backgrounds that are increased risk for genetic disorders. They include African Americans having an increased risk of sickle cell disease. Patients with a Jewish descent actually have an increased risk of Tay-Sachs disease and a variety of other genetic abnormalities. And patients from the Mediterranean and from Asia are at increased risk for thalassemias. So everybody has some increased risk based upon their own specific ethnic background, and that often becomes an indication for testing alone. The other thing that's important to do is to look at your own personal family history to see if there's any family histories of genetic disorders, and if there is, frequently those are things that we can evaluate for in advance and learn if you're at increased risk for having a child with those genetic disorders. Another question I'm frequently asked is, what are chromosomes and genes? A man's sperm typically has 23 chromosomes, and a woman's egg typically has 23 chromosomes. When an egg is fertilized by a sperm, the resultant embryo therefore has 46 chromosomes, of which half of the chromosomes come from the egg and half come from the sperm. Chromosomes contain DNA, and the DNA sequence is what results in genes, and genes are the regions of the chromosome that helps to determine how you look, what your hair color is, what your eye color is, and also can carry genetic abnormalities. Genes come in pairs, and therefore half of the fetus's genes come from the mother and half of the genes come from the father. There are many different types of genetic disorders. However, two of the most common genetic disorders are autosomal dominant disorders and recessive disorders. Dominant disorders are disorders in which if a child has one abnormally inherited gene, that gene coming from either mom or dad, the child can then have a significant chromosomal problem. There are also autosomal recessive disorders, and these are disorders that actually require two abnormal inherited genes. Since half the genes come from mom and half the genes come from dad, An autosomal recessive disorder requires that both parents carry that same exact disorder, which once the child gets one abnormal gene from mom and one abnormal gene from dad, results in the child having an abnormality. As I mentioned in the prior slide, recessive disorders require that both parents have the same abnormal gene and would require that each parent gives one abnormal gene to the child, which then would have a genetic defect. It's important to note that if you as a parent have one normal gene and one abnormal gene for a particular recessive disorder, you are considered a carrier for that disorder. And frequently, you won't have any symptoms or won't have any idea that you're a carrier for that genetic disorder. But it's also important to note that if you're a carrier and you're completely asymptomatic, you still have the ability to pass the abnormal gene off to your children. There are literally hundreds of different autosomal recessive genetic disorders which have been found, and at least 1 out of every 6 of us carries significant genetic abnormalities that we wouldn't otherwise know about. Given the high incidence of these recessive genetic disorders, we fortunately have tests that are available to test for some of the common disorders. This is called carrier testing, which allows us to detect if either parent is a carrier for a specific genetic defect. The carrier testing can be done before you actually conceive with a sample of blood or saliva that can then be studied in a lab. Results typically take 2 to 3 weeks, and if abnormalities are found in the testing before pregnancy, medical treatments are available that can actually lower the chance of having a child with a birth defect. Those techniques can include things like in vitro fertilization with preimplantation genetic diagnosis, allowing us to diagnose if the embryo has an abnormality in advance. Other things that can be used are donor eggs, where we use somebody else's eggs to help you conceive, or donor sperm, where we use somebody else's sperm to help you conceive. Some of the recessive disorders are so common in the general population that their testing is indicated for all women interested in conceiving. This includes cystic fibrosis and spinal muscular atrophy. Other tests can be done if your family history, ethnic origin, or some other risk factor increases your risk for being a carrier. The important thing to remember is that there are no carrier tests for the majority of inherited birth defects. And that's important enough to repeat that a lot of birth defects, as a matter of fact, the majority of birth defects, we don't know of the specific gene or the carrier state that we can test for. I've mentioned in the earlier slides that there are ethnic backgrounds that increase your risk for having genetic abnormalities, and in front of you is a list of 6 common ethnic backgrounds and what their increased risks tend to convey. And it turns out that for all patients, cystic fibrosis and spinal muscular atrophy testing is recommended by the American College of Obstetrics and Gynecology and the American College of Medical Genetics. If you look specifically at the Ashkenazi Jewish population, you can see that there are a significant number of chromosomal abnormalities such as Tay-Sachs disease, Canavan's disease, Gaucher's disease, which are at increased risk, and therefore the American College and the American College of Medical Genetics recommends testing of the Ashkenazi Jewish background with all the tests that you see on the bottom left. If you're of Asian descent, there's an increased risk for beta thalassemia. Hispanic descent, an increased risk for thalassemia. Mediterranean descent, the same, increased risk for thalassemia. And the African American population is associated with an increased risk of sickle cell disease. So the important thing to do would be to look at your ethnic background to figure out if you're at increased risk for genetic abnormalities and consider whether or not you would like testing for those abnormalities. Just as this dog's trying to evaluate its risk before it jumps over the cliff, couples wanting to conceive should actually step back and take a look to see if they have any individual risk factors that they may want to consider and investigate before they try to conceive. Risk factors can be a maternal age greater than 35 or a paternal age greater than 50. We know that there's a family histories that have genetic abnormalities such as Down syndrome, neurotube defects, which are spinal cord defects, or heart and defects, which are things you may want to ask your family members about to see if there's any of that in your family history. We also know that genetic abnormalities such as hemophilia, muscular dystrophy, cystic fibrosis, Huntington's disease, mental retardation, diabetes, and miscarriages can all be risk factors for having children with birth defects. On this website, there's a coastal fertility specialist genetic disease information sheet, which can give you more information about these genetic disorders. If you have questions, I'm available to go over some of those with you. And we also have genetic counselors available who can help counsel you about the risk factors based upon your family history, how many family members were involved, how close to family members were genetically to you. Those are all important characteristics when thinking about additional risk factors. The previous slide mentions the increased risk of having a child with a birth defect based upon maternal age. We do know that as a woman increases her age, there appears to be a decreased quality of the egg within the ovary, which results then in an increased chance of having a child with a genetic abnormality. The table you see on the bottom is separated into 3 columns, and each column has a different meaning. The first column shows the age of the woman. That's the column on the left. The middle column shows the risk of having a child affected specifically with Down syndrome, which is an extra chromosome number 21. The risk on the right, in the right-hand column, is the risk of having a child with any birth defect at all that's considered a chromosomal abnormality. And as you can see from the table, if you're 25 years of age and you conceive, your risk of having a child with Down syndrome is 1 out of every 952, and your risk of having a child with any chromosomal abnormality is 1 in 384. Going to a more extreme example, the bottom shows a woman 45 years of age is estimated to have a dramatically increased risk of having a child with Down syndrome, with that risk being 1 out of 38 births would result in a child with Down syndrome. And looking for any specific chromosomal abnormality, the risk is 1 in every 26 live births, showing that increased risk. These increased risk of chromosomal abnormalities associated with maternal age are generally not able to be reduced with preconception testing. However, during the pregnancy, we can test for the normacy of your fetus to make sure it has a chromosomally normal genetic makeup, and that can be done with amniocentesis and even some newer tests where we can actually draw the maternal blood, check the blood while you're pregnant to look for small pieces of fetal DNA circulating in the maternal bloodstream, and that can then be tested to see if there are genetic abnormalities. A common question is, can you lower the risk of having a child with a genetic disorder? And the answer is yes. It's important to know, however, that there are not any tests that eliminate your risk of having a child with a genetic disorder. There are things, however, you can do to lower the risk. The first would be to undergo testing for the conditions you feel that you're at increased risk for based upon your age, your personal family history, and your ethnic background. Another option would be to spend time with a genetic counselor who would spend time going over your personal history, your family history, your ethnic background, and with that be able to help make recommendations, with recommendations being what testing would be appropriate to help lower the chance of having a baby with a birth defect. Some of these tests and counseling sessions are done in person. Some can be done over the phone. Generally, the cost is approximately $100 or less. It's my personal recommendation that you strongly consider genetic counseling, as they will help to identify increased risk that you have and can help you in a more cost-effective manner screen for genetic abnormalities before you move on with infertility treatment. So the obvious question is, should you and your partner undergo testing for genetic abnormalities before you conceive? And there's no doubt in my mind that this is a very personal choice. Some couples would rather not know if they're at increased risk for a problem and work together to help conceive on their own and take the risks. Others feel that they would benefit from knowing in advance because in some cases they may want to do something to lower the chance of having an abnormality if there is one detected. The most important thing to me is to make sure that you and your partner understand that you're at risk for having a child with a genetic abnormality, and there may be ways you can lower that risk. It's important to me that you discuss those and make a decision before you start infertility treatment. It's very important for you to know that your choice will not affect in any way how we treat you at Southeastern Fertility Center. Thank you for spending time with me today to discuss preconception genetic testing. It's very important to me that we provide high quality patient care, and that's the reason that I created this video. I want you to be fully informed about your diagnosis, your treatment options, and your treatment course so that you know the likelihood of success and the cost. If you have any questions about preconception genetic testing or any other aspect of your care, please feel free to call me or your nurse at Coastal Fertility Specialist at 843-883-5800. If you decide you want to move on with treatment without any preconception genetic testing, it's no problem at all. There's a consent form on the website that you can sign. You can then fax that or email that to us, and then we'll move on with treatment. If you decide you do want testing in advance, testing is done typically through blood work. That can be done, and about 2 weeks later we'll get the results, and in most cases your insurance will actually pay for the testing. If you'd like to meet with a genetic counselor, there's a variety of different genetic counselors available through the Medical University of South Carolina or through other agencies. Thanks for spending time with me today. Hope you have a great day and look forward to seeing you soon. Bye-bye.